Thank you all for joining us today for the Family and Systems Integration and Crisis Services for Children and Youth webinar. Next slide. Before we get started, I do want to just take just a moment to ensure that everyone in the audience is ready and comfortable with technical aspects of the webinar. As you'll see at the bottom of your screen, we do have American Sign Language capabilities enabled for this webinar. You'll see a notification that sign language interpretation is available if you just select that option. It should pop up in a pop-up box for you guys. If you have any issues or need additional tech support during today's webinar, if you can just send myself a chat, I will make sure that we address that for you. So I do want to take note that the views expressed in written conference materials or publications by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements for the U.S. government. Next slide. My name is Bree Carr, and I have the privilege of serving as the project manager for SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center that is operated by Autarm. Today's webinar is hosted by SAMHSA's 988 Crisis TTAC, which provides training and technical assistance support to states, territories, tribal organizations, and community partners across the 988 Suicide and Crisis Lifeline and Crisis Continuum of Care, along with our partners at W2 Consulting and Change Matrix. We have an extensive experience with crisis services and technical assistance. The Crisis TTAC is formed to support the continued growth of the 988 Lifeline and building a more robust crisis systems. Next slide. Today's webinar is a training and educational opportunity related to the design and operations of crisis systems, where we will be focusing on learning more about family and systems integration in crisis services for children and youth. There'll be time for questions at the end of the webinar, and then there's also a Q&A feature that is at the bottom of your screen, so where you can also submit questions throughout the presentations, and our speakers will make sure that we address those throughout the presentation for you guys. If you have any concerns or need to chat with a crisis counselor, you can always utilize 988 for additional resources. And then also utilizing the Crisis TTAC for additional technical support or feedback. And you can reach us by contacting us via email at support@988crisisttac.org. All right, so just a quick overview of what you guys can expect today in terms of the webinar. So our learning objectives are to understand the crucial roles that families play in the crisis systems of care. We'll discuss integrating families into systems and services, exploring the best practice models, as well as looking at innovative approaches to integrate families into our crisis systems of care. Next slide. In terms of our agenda, so as I stated before, we'll go through some introductions of our speakers. We will have speaker presentations. After the speaker presentations, there will be a poll for you guys to complete for feedback, as well as a slide where you will be able to scan and complete your evaluations if you are looking to obtain continuing education credit for today's webinar. We will also have a component that will focus on questions and answers that were submitted pre-webinar, as well as any questions or answers that come up during the presentations. And then we will transition to office hours, where we will give you guys the opportunity to meet with the TTAC to ask any additional questions, particularly if you have any specific needs for yourself or organization. Next slide. Okay, I do want to take just a moment to acknowledge our SAMHSA partners. Jill Mace, who's the Division Director for the Crisis System Transformation at the 988 office, as well as China Lockler, who's our Public Health Advisor, who has worked very closely with the Crisis TTAC and the Child, Youth, and Families Workstream to develop and host this event for you guys today. Next slide. Okay, I do want to go ahead and hop into giving you guys an introduction of each of our speakers that we have today. I want to start with Millie Sweeney. Millie is the Director of the Learning and Workforce Development for Family Run Executive Director Leadership Association. also known as FREDLA. A lot of words there. FREDLA is a national family-run organization that is focusing on supporting families of children and youth with behavioral health challenges. Next slide. Okay, our second speaker is Lindsay Stone. Lindsay currently serves as the Senior Director of Children and Youth Mental Health Programming at the McNabb Center, and she also oversees the children's mental health programming in Knox and surrounding counties in Eastern Tennessee. Next slide. And our third speaker is Dana McCurry, who currently serves as the Director of the Office of Recovery Transformation, also known as ORT. In this role, she works collaboratively with the Department of Behavioral Health, and she works with directors, advocates, community stakeholders to promote the inclusion of the lived experience, as well as expansion of opportunities for certified peer specialists. And with that, I will pass things over to Millie to get us started.
Thank you. Good afternoon, everyone. I'm excited to be here and to share information that hopefully will strengthen your efforts to integrate youth and families into your crisis work. So I want to start with the fact that the relationship that families have with providers and with others from the child serving systems is really important to them. In fact, for families, that relationship is actually an outcome that they prioritize when they engage in services, including what happens when they're in crisis. In 2023, FREDLA, in collaboration with a couple of our research partners and family-run organizations across the nation, completed a research project that was funded by PCORI, where we ask youth and caregivers which outcomes matter the most to them in behavioral health. And the graphic that you see here really highlights the top 10 for parents and caregivers. That's in the teal color, the teal circle. And then the outcomes that matter most to youth are in the reddish orange type circle. Where there are commonalities and common priorities, they're in the middle where the two circles intersect. What we found that's really interesting is that families consider the experience of accessing and receiving services as an important outcome for them. In this study, youth and caregivers really prioritize service quality outcomes. Caregivers especially expressed a desire for an accessible, respectful, and supportive treatment environment. And that was underpinned by well-trained and culturally responsive professionals. Caregivers also said they really want a seamless cross-sector provider collaboration and easier care transitions that integrate the insights and the preferences of families and children's. So crafting a customized care plan. Youth wanted to be heard. They wanted to have their ideas and their goals acknowledged and valued. And they wanted to engage in positive interactions with their providers as well. Next slide. To form relationships with providers, families have to be fully engaged as partners. Over 30 years of research have shown us that engagement in families is critical. This document, the slide that you're seeing, is a compilation of those 30 years worth of research. And engaging and partnering with families has positive outcomes for everybody involved. For the children and youth, it improves their adjustment and functioning. It really prevents deeper engagement in some child serving systems. For their families, for agencies, it even helps with satisfaction of staff. For communities, for child serving systems, including a more effective use of resources and reduced out-of-home placements, and even for managed care. It's a return on investment and improves coordination of care. We're going to drop this graphic, and there are related graphics with it in the chat, because I'm going to refer to those later on. And I know this is kind of small and maybe difficult to read. So you'll have that on hand. Next slide. As you can see, there's a whole lot of value in youth and family partnership, especially when it comes to addressing crisis services. Youth and family partnership changes institutional culture and practice from leadership to the types of services offered. It builds awareness and understanding of families' individual situations, as well as builds self-efficacy for parents and a sense of community for the whole family. New practices and effective policies evolve from fully engaging and partnering with families at all levels. It not only improves individual child and family outcomes, but also the entire organization's outcomes, meaning staff and mission are positively impacted as well. Youth and family partnership informs the realignment of resources to services that families identify as helpful and what they really need. Their participation, including leadership in research and evaluation, helps in interpreting and maximizing the use of any data that you collect. Engaging families in policy work yields policies and processes that positively impact families and communities and avoids often unintended consequences of policies that are developed in a vacuum without their input. Next slide. Now, I want to talk specifically about the importance of caregivers and family when a child or a young person is experiencing a crisis. Of course, caregivers have legal and financial responsibilities regarding their child, so they must be involved when there are discussions about a child being treated outside the home, as well as any costs or insurance coverage that may be involved in accessing services. Parents and others that the young person considers as their family have important information about their behavioral health history that includes medications, treatments, what's worked, the way not to approach a young person who may be in a crisis at the moment. This expertise can help the child's team get to effective approaches or treatment much more quickly. Thirdly, families are the main support system for children and youth before, during, and after a crisis. They have to be involved as a part of any efforts if you want to prevent future crises, if you want to effectively address a current situation, or ensure implementation of follow-up support services after that crisis is resolved. Parents and families are your partners in any interaction, as they have access to information about the child or the young person or the situation, as well as to existing supports that are a part of that child's life. Now, importantly, we have to realize that when a child is in crisis, so is the caregiver. When our kids are not doing well, we're usually not doing very well. So we need to, in the moment, address not only the young person's needs, but their caregiver's needs as well. Children often react to their caregiver's stress by becoming more stressed themselves. So helping to calm a caregiver can directly impact your efforts in calming a child, in identifying what's needed, and in accessing appropriate supports or treatment. So you have to address the caregiver, not just the child. And this has to be a principal part of any crisis program or approach in children's services. Next slide. So partnering with families is really crucial at all levels, but I want to start with how this can be done at the individual level. That's directly with the young person, their caregiver, and their identified family members. So youth and families have shared their thoughts with us about experiences, about crisis services, what they think would work and what doesn't work. So this is what families say about current crisis services. I want to go through a couple of these. Police intervention does more harm than good. And they really feel that that can criminalize mental health. And we already have this disparity between, how we treat the brain and how we treat the rest of our body. How you approach the situation is important because first impressions will impact the outcome. And that includes the terms that you use because words matter to families. Respect the family expertise and knowledge and the youth's agency and their consent, their autonomy. Families say they really need more options, that inpatient hospitalization is not the best route for them. And I know we look at it as sort of a last ditch type thing, but for them, it just really isn't the best route overall for kids and families. And concerns about access to medications that are life-saving. A lot of times these things are very limited when they're given options in the moment, when families, again, have expertise about what's worked and what hasn't. And what we heard overall is that peer support is critical in this in all ways, whether that's a warm or a hotline, whether it's in mobile crisis and in first responders. It is absolutely a critical piece to them being able to move past a crisis and to be able to prevent future crises. Next slide. Now, what families said they wanted from crisis services is to develop programs, policies, and processes in partnership with them. They want the options that are built, that are available to them, the choices that are available, informed by them. Also allowing them to define what the crisis looks like. It isn't the same for everybody. It isn't the same for people within the same family. Everyone defines crisis differently. They ask that you reframe your role as a guide or a support on that individual's journey, rather than an expert who is there to just do some checkboxes and funnel you toward a specific service. That is a limited option menu. And again, language matters, particularly how you refer to the youth and the family, the tone of voice, and even the choice of the terms that you use. It's important to explain why something is happening, why something can happen, why you're taking a particular approach, or why you would recommend a certain support or service, rather than just saying because that's the best. Sort of it coming from that expert view, come from it as a partner view. And continue to be data informed, evaluate what you do, counter misinformation that's out there, and use the validated science about what is important for particular populations. Next slide. Partnering with youth and families at the individual level means that we need to build this array of services and supports that's not just for crises, but that embeds crisis services as part of this comprehensive service array, and that it's built with youth and families, and it serves the community in a culturally responsive way. And it should be informed by what they say is needed and wanted. It means that we, as providers and systems, should examine our current services, developing and funding what families prioritize, not just what we've always done or that has been developed without their involvement and input. The services and support should reflect and be operated under a system of care approach in their values and principles. It's a framework that prioritizes that family partnership and prioritizes coordination at all levels, including training our workforce so that they're supported to implement that type of approach. In terms of crisis services, it's important to develop and implement services and supports that meet families where they are and that they're accessible in different ways. Hotlines, mobile crisis, stabilization units, virtual and in-person support, those type of things. And ensure that crisis services are connected to and they're coordinating with that broader array of behavioral supports. Processes that are developmentally appropriate, that are culturally responsive, that facilitate linkages and easy transitions between different services. So let's focus for just a few minutes on the importance of and strategies for integrating youth and families into crisis services at 3 different points in the individual level: prevention, during a crisis, and post-crisis. Next slide. So it's important to integrate families in crisis prevention. They will be a huge part of intervening in the moment when they can see something start to happen, that crisis starting to brew. And they have historical knowledge. So they know what worked, what didn't work, what may be triggers for their young person or for their family as a whole. So some of the strategies to integrate families into that is education and information, particularly on recognizing some of those precursors and understanding them. Train families on intervention strategies. Plan with them what to do, what supports are going to be needed. And make sure that when you're working with youth, you ask them, who do you consider to be your family? And not do you want family involved, but how would you like your family involved? Because there's all sorts of ways that can happen that still respects the autonomy and the confidentiality of that young person. And so youth and parents may have different views and needs and capacity for prevention activities. You have to respect and work with them what their needs are. So that's in prevention. In the moment, during a crisis, next slide, please. It's important to integrate families because supported parents are able to support their child or their youth in crisis more effectively. Remember, if a child is in crisis, their caregiver's probably in crisis as well. And families define who is family. They may have supports that you're not aware of. So you can see here are several strategies for that. Training families to use particular strategies in crisis situations. You can recognize and make sure you're addressing the parent crisis, not just the child. Treat families as partners. They have expertise, they have knowledge, use it. Respect who they involve and who they don't involve in their situation. There's probably reasons. And respect that youth autonomy and family perspective. You can seek compromise and make sure that there is safety in place. Next slide. In post-crisis, you want to integrate families because they're key partners in any follow-up tasks, any connections that have to happen following the resolution of the crisis. They tend to be that default support system for young people. So include them in debriefing and planning, any next steps that are happening, and ensure that you are addressing the needs of the family, the youth, and the caregiver, and recognize those are not going to be the same. And you want to make sure that you are facilitating connection with ongoing supports. Please do not hand them a list of numbers because they've just been through a crisis situation. They're going to need someone to support them in making connections that work for them, not just a list of numbers to call and try out. Next slide. We're going to move on to program and system levels. In terms of crisis services, develop and implement them that meet families where they are and that they are accessible in all those ways. Make sure that it's connected to that larger array of behavioral supports. Youth and families can help you develop and implement effective crisis services because they have this expertise on family-driven perspective, strengths, needs, and approaches. And in each community and state, youth and families can inform what the mix of services should look like that's most effective for them. And that facilitates a more streamlined approach to addressing child and youth crises. That helps in strategically using what are often limited resources. Next slide. Partnership with young people and families at all levels is the foundation on which everything else should be built. They are equal partners with providers and systems. They provide that unique lived experience to inform, collaborate, and evaluate, and consistently help us move toward a better and more responsive way of working together that benefits everyone. In the chat, we're going to drop another document that has guiding questions that you can use to explore how you can involve youth and families across all aspects of system operation and improvement. And I encourage you to use that. Now, critical to implementing this approach is recognizing that there are unique considerations for youth and young adults and for caregivers and families. Their voices, their experiences, their perspectives, their ideas are not the same, and each should be respected, included, and valued. I would say that's especially true in crisis services, where the needs and priorities of youth and their family can differ. And knowing that helps us intentionally build responses They're informed by what they say work for them and help them through those times of crisis. Partnering with and being inclusive of various youth and family voices strengthens your efforts, really. So partnering with families requires this multifaceted approach. They have to be able to be engaged in different ways. Next slide. This shows a lot of different ways that you can integrate the voice of youth and families and partner with them. From the least intensive, kind of they can inform things, all the way up to empowering them to be part of the workforce, to be leaders in your system. And so these are just some examples. And then what underpins all of that are the things you see in the green: safety and transparency and trust, empowerment, mutuality, peer support, again, continues to come up as a critical piece of this. Next slide. Now, this looks like the one you just saw. It is not. This is translating all of those outcomes to how families can help impact that. And so this shows more than 50 ways that you can partner with families and family-run organizations to achieve those outcomes that were laid out in the research that we reviewed earlier. Again, this is, I think, is the third page of the document that we dropped in the chat earlier, so that you can see the different types of activities that families and family-run organizations can play and support and be part of, to better build a system that gets to the outcomes that we all got into this work to do. Next slide. One of the most effective ways overall to infuse youth and family voice in this area in crisis services is the inclusion of youth and parent peer support. Cannot underscore that enough. According to those that receive peer support, having someone with lived experience walking alongside them, supporting them, helping them navigate difficult situations can be the most important factor in making it through, in navigating the services, resolving crises, getting what they need, learning coping skills, having hope, all the things that peer support providers do. And in a comprehensive service system of care, especially crisis services, these types of peer support are a mandatory part of the service array with lots of ways to access. It's not just the high-end services and not just in crisis response, but at all service intensity levels. People should have access to peer support. And as with any quality service, implementing effective youth and parent peer support, and they're not the same, requires several considerations. They should have appropriate training, certification, and professional development for each type of peer support and pathways for advancement. The roles should be clearly defined across service intensity levels, and both youth and parent peer support infused into service systems with equity. And that means equity in roles, requirements, qualifications, on par with degreed professionals. They're non-clinical, and they provide a very important service that enhances all the necessary clinical services. Peer supervision is critical, along with training and professional development for those supervisors. And finally, payment structures should be developed, including adequate rates and salaries that facilitate thriving, not just surviving. So with that, I have another 2 slides that are just info on Fredla and my contact information, but I wanted to give a chance for any questions or comments.
Hi, Millie. We did get a question in the chat. The question that was asked was, do most states use Federation of Families for family peer certification, or do states have their own certification for family peers?
What we see nationally is certification happens in one of 3 ways. They require the National Family Peer Certification, which is now across the lifespan, not just particular to youth and children, and operating in that system. The second way is that the state may say, we're going to do the training here. We have required training, but you have to take the test for the national certification, because that is an exam that you have to have training hours in certain areas in order to be able to take the exam. The third way, which is the most common way, is that states develop their own, that has specific pieces that are relevant to their state, but it is often starts with the competencies that are listed in the national certification. And then what I see is that they tend to expand based on what is needed in their state. So most will end up developing their own certification that includes a specified training or group of trainings, or training options. You can take one of three, something like that. It has application requirements, obviously, qualification requirements, and then sometimes an assessment or a test, or as one of the states I work with, a celebration of knowledge is what they use.
Thank you for that response, Millie.
Yeah. Are there other questions? I know there were a couple that came in prior to this that I could address.
I have one question that came in before that you could probably speak to in terms of, one of the questions that came up was, are there boundaries that should exist with the roles that family peers play in crisis response?
I would say that every role in crisis response has its appropriate boundaries in what they do and don't do. I just know that what we hear from youth and families is that peer support is an absolute critical piece of that, and sometimes the key to getting through a crisis. But they should have a role that is applicable to the lived experience and what they contribute, just as, a clinician has a clinical role and has certain things they do and don't do. It's the same thing for each profession. In terms of where they can be implemented in crisis services, they should be on warm lines, hotlines. If they're doing hotlines, specifically need to have some clinical backup, in the event of, really clinically involved situations. They should be going out with mobile crisis teams. They should be part of any aftercare, helping families and young people get connected to what they need and navigate through finding that, getting engaged in it, so that we can prevent further crises.
Thank you so much for that presentation and answering those questions for us, Millie. We greatly appreciate that. And Erica, you can transition to next slide.
If there are any more questions for me, I can go ahead and pass that over to Lindsay, a fellow Tennessean. I'm in Middle Tennessee and she's in East Tennessee, to talk about McNabb.
Hi there. Thank you, Millie. Such a great kickoff to this, and you'll hear some common threads in what I'm getting ready to talk about. But yes, you can go ahead and advance the slide. If you're not familiar with McNabb Center, I am going to cover the East Tennessee side of the state. We serve about 30 counties across East Tennessee with a variety of services. I'll just give a quick introduction on the next slide of really our continuum of crisis services, and then I'm going to spend some time talking about the ones that we incorporate families the most and my experience in our continuum here. We have a family walk-in center that we've had for the past few years. I'll spend a good amount of time talking about that, as obviously families are a crucial component in that service delivery. We have Tennessee's first children's crisis stabilization unit in our area. We operate 2 adult CSUs. We have a mobile crisis unit, a behavioral health urgent care center. Just recently opened Tennessee's first empath unit. And some of the innovative approaches that you'll hear me talk about at the end that we've done also over the past few years to strengthen our continuum is doing crisis response teams for high child serving environments like our school-based regional schools, our juvenile justice detention centers, and really embedding crisis support in environments that we know children and families are going into on a daily basis for their natural support. And then we have a co-response with our local police department as well. That gives you an idea of our continuum. But as we go to the next slide, I'll kind of set the foundation, as Millie did, of why we see family integration so important in all of these services. As we have several different levels of crisis services, we obviously want families to be able to access what they need in the moment that they need it. That's the foundational support. But what we see as the positives of the integration is just those better patient outcomes. Millie referenced this in her presentation. We see better outcomes when families are involved and engaged through the whole process. We see fewer relapses and longer duration between relapses, reduced hospital admissions. We want them to have the right level of care that they need. And when and if they do access those higher levels of care, they're shorter inpatient stays. That's what research shows us when we have good family integration and engagement. Improved treatment compliance. When you've got a family system around you that's alongside of you for the journey, that's aligned with your goals for treatment, for recovery, then we see those, we see compliance and engagement increase with that as well. Reduced severity of episodes, the cultural integration, making sure that we're connecting individual needs, that we're understanding the culture of every family and youth that's entering our services so that we can adapt treatment to those individual needs. The environmental safety, I'll spend a little bit of time in the end talking about some resources that we work with families on how to do safety sweeps or setting up their own environment for safety. We also know that families are the pipeline to usually do school reentry when a child has had a crisis episode, that parents are having to communicate with school systems and other partners in their child's life and helping set up an environmental safety around them. So we've got to equip the families to do that first. And obviously empowering families with knowledge and skills offers support, hope, equips them to feel more confident to address the needs within their children and youth within their own home. And so as we go to the next slide, one of the first areas I wanted to talk about is just how that environment sets the tone. We referenced it, and I wanted to talk about some specific ways of how we've addressed it. We have a family walk-in center that I'll show you some pictures in a minute. We're open 365 days a year for crisis walk-ins. But one of the unique things that we really advocated for early on was to make sure that it wasn't just a walk-in and refer you out to outpatient care the next day or possibly call our mobile response team, that we wanted to have really a longer period to address the episode or the crisis with the family. So those families and youth can stay for 6 to 8 weeks of care, therapy, assessment, medication services, sometimes just de-escalation, case management, any of those for that 6 to 8 week period, giving the family support alongside the youth and making sure that we can set up a long-term treatment plan and referrals for them in that process. We also made sure that we chose a building that we could create respite space and breakout space for different age groups for children so that children have an environment that feels comfortable to them to address their stress or their crisis, but families also feel comfortable walking in the doors with their youth as well. We place a high importance on community-based care and doing wraparound services and natural support environments. So you'll see that integrated in all of our services that we're in schools, homes, communities, after-school care, making sure that we're addressing the environment that the children are walking into every day. And then, as I said, we opened Tennessee's first crisis stabilization unit for children in the summer of 2022. And we are co-located in East Tennessee Children's Hospital. And so partnership has also been a key for family integration with us to make sure that we chose an environment that was already a family-friendly resource to our community, and really choosing that environment to put the service in has also helped with our family integration across our region. And so as you go to the next slide, I'll show you those pictures like I promised of some of our walk-in center if you're a visual person like I am. To the left of your screen, you'll see the Mindful Moments corner that kids see right when they walk in. It's basically an art area that as they're there, whether it's the first day or the 20th day that they've walked into our center, they can leave artwork, hopeful artwork for the next child that enters. It's become one of our favorite corners because it shows the connection point that there are other kids that are walking in the door with similar stressors that families see see that they're not alone in what they're dealing with. And so we've allowed that creative space for them to come into. We also offer what I call our hospitality section in the middle of our open area of our walk-in center. Families and kids can make a cup of coffee, grab a drink, grab a snack. It's freely out there for them to get at any point. I always say that you don't have to tell kids where the snacks are twice. So anytime they're repeat coming back through the door, they're beeline directly to that area, which we know that supplying physical needs for families in crisis is also reduces that barrier as well. You can go to the next slide to see our breakout rooms or our respite areas. One of the visions that we had when we talked about a family level of care is making sure that we were allowing families to experience crisis in a different way, in an environment that felt comfortable to their needs at that time. So the picture on the left side of your screen is our younger child respite room. So we've got kid-sized recliners, a Nintendo Switch, a reading area, a fidget station that's just out of the camera there, a race car track on the floor, just lots of welcoming. It almost looks like a bonus room, a bonus playroom that you would see in a house, making sure that they have an area to go to. The right picture is our adolescent respite room. So we've got gaming chairs, adult-sized beanbag chairs. There's an art therapy corner, a PlayStation in there. And what I have found in these two areas, and our staff would say the same thing, is that more family interventions happen in these two rooms than any of our other assessment rooms that we have in our center, because a lot of times the kids land here, whether before or after that we've de-escalated them or talked through what led them in the door, and then we'll deal with the parents or the guardians, and then we'll integrate the families into these rooms to kind of end and talk about where we go from here. And so a lot of the interventions happen in these spaces, which is really what we wanted. And so it just drives home the point that environment matters. Feeling comfortable and having a welcoming experience does matter when you're in crisis, and really just in everyday life. You can go on to the next slide and you'll see a little bit of our Children's Crisis Stabilization Unit. We have a 12-bed unit here in East Tennessee. So one of the things that was really important to us in doing a children's CSU was to have enough spaces to break out developmental age groups. So I couldn't get all the pictures on here, but we've got the picture on the left side is more of our ligature safe lounge area, so they can come back and have kind of a recliner to watch a movie, have more of a talk session in a comfortable environment. But we also have group rooms that are more dining and rec areas, more of the traditional group spaces. We have an art therapy room. And so there's just different spaces to divide up developmental ages of kids, but also give them the space that feels comfortable to them in the moment. To the right side of your screen, you'll see one of our bedrooms. All the children have individual bedrooms, but the two bedrooms in the back of the unit, we have what we call these parent loungers that allow parents to either come in to help get their children established, stabilized, or stay for a brief period, knowing that some of our kids have never been away from home, or parents might need to feel more comfortable about leaving their child for an overnight stay. And so we specifically did rooms and positioned them so that families would be able to be incorporated when and if that's needed. And those are just some of the physical things that we've done to incorporate the environment as well. You can move to the next slide. So one of the things before we move on to the next section of just giving parents a voice, one of the things that we really train our staff on and really help them focus on is connection over conflict. But it's also the same approach that we take with our families. So obviously, our families that are entering at whatever level of crisis services, there's a high level of conflict that has been very intense in that moment for them, or has been building over a long period of time that is carrying a lot of stress and weight for the family. And so not only do we respond with the goal of connection to build trust pretty quickly in a crisis episode, but also helping families understand how to prioritize connection over conflict when they're going back home, when they're going back to school or their stressor. So as we go to the next slide, just referencing some of the ways that we try to do engagement through the whole process. This aligns with a lot of the things that Millie said as well, is that doing the proactive approach to engage early. So we do a lot of outreach and awareness. Anytime I do a presentation, if it's just a topic on addressing or recognizing depression or anxiety, I'm always including slides about our family walk-in center, our children's CSU, our mobile crisis numbers, making sure that families have the resources resources when they need them, and that they know that they're there when they need them. And that's a part of that early engagement of making sure that families have options, making sure that we're including them in the screening and the assessment. They have such valuable knowledge of what's going on, what are school staff saying to them about their child, making sure they're incorporated in all of those processes. And then involvement in treatment, making sure families are involved throughout the whole process. So different than our adult CSUs, we're going to do family therapy throughout the process when they're in our care, but we're also going to allow families to come to our family walk-in center, even while their child is in school if they need a little bit of extra support. So making sure that we're giving them the place to get that support alongside their child. And then obviously incorporating them in discharge planning, making sure that families feel good about the plan that we're creating alongside of them. Making sure that they're okay with the services that we're setting up. If they're not okay with what we're setting up, it's not going to be successful. So making sure that everybody's aligned and has a good plan before they leave our care. You can go to the next slide. Treatment approaches that we try to have, and I just wanted to reference here, we use a lot of CBT, DBT, dialectical behavioral therapy in our approaches, but what we really try to do across our children's crisis continuum is a shared language, so that as we use these DBT components of mindfulness and kind of symptom awareness, how we interact with each other, emotional regulation, those types of things, that we're also equipping our parents and guardians and families with those, the family system that's around that child, that they also are building those skills at the same time the youth is building those skills. And so we also expect our staff to have that shared language when we're talking with our families as well. You can go to the next slide. Not going to reference all of these, but just as an example, as you'll have this for your reference, we really try to talk with families about how to talk to their child about their mental health, how to talk to their child when they're in crisis, making sure that we're not assuming that families have these skills and that they're dealing with their own emotions and stressors at the same time. So what a safe space looks like for them, how to validate feelings and experiences and not behaviors, how to listen and offer the child to ask questions as well. Not being afraid to ask hard questions about suicide or questions about if they're having self-harming thoughts, those types of things. Equipping families to have the skills to navigate that crisis with their child and being proactive for the future. You can switch to the next slide. Safety planning is obviously a big part of incorporating our families as well. So engaging the families and as many people as that youth identifies or that's available, because like I said earlier, we have lots of environments that those kids are going to. So we want to equip that safety planning and incorporating as many family members as we're able to in that process. One thing that we see, families can sometimes feel like, is it always going to be this hard? Am I always going to feel like I have to keep my eyes on my kid at all times? And so we try to use, again, that shared language of using phrases like, you may not have to live like this forever, but for right now, we need you to do these things to be diligent and keep your child safe. Really keeping them focused on the moment that's in front of them and the short-term steps instead of getting too overwhelmed with the long-term process. Making sure that families have those options, making sure that they have resources and references to get when they need it as well, as I referenced. Next slide. And finally, just the last few things when we talk about follow-up, and you can keep going to the next slide. We create resources, as we know, families in crisis and when they're dealing with lots of information overload all at once, making sure that we have resources and practical things to give them to. This is one example that we did when we had our initial SAMHSA grant with the Children's CSU. of creating a resource guide, a safety suite flyer for them to have them reference when they get home. What items do they need to look for? How they need to walk through their house? What does that look like on their phone or online resources? How to talk to their child? Things that they can reference, emergency numbers for the future when they need them. So just having very practical resources for our families to reference has become a crucial part, and I think a good safety line for our families as well. You can keep going. I talked about our innovative approaches. One of those is our Tennessee Resiliency Project, where we've created crisis teams in our school-based services and our juvenile justice centers and in our crisis services as well, to create teams that can really pivot and go at a moment's notice to a school to do a postvention if there's been a crisis or a death. If there is a training topic that a school needs to address because they're seeing an increase in anxiety in their school culture, we can also help families and schools navigate a crisis. What would the next steps be? Doing short-term crisis services. And so one of the things that's been crucial is to have a crisis team that can pivot and go at any point during the day or with a day's notice to address crisis needs within our community and helping support families navigate the other environments that their child is in. Next slide. The last is just education for our resources or our locations, our hours, my contact information is at the end. As you get this resource or have any other questions going forward at the end of today's presentation or after, I wanted you to be able to know where we're located, references of slides that I've talked about as we've gone through today. But this is such an important conversation, and we want to make sure that everybody has the resources to equip your own areas with these services. Thank you very much for the time, and I think our third presenter, Dana, is going to come up next and wrap us up, and I'll be back for questions later.
Thank you, Lindsay. Are you sure you don't want to answer some questions now? There were answers and questions in the chat.
I've captured them for the Q&A section, Lindsay. So I've got all the questions, and then I'll bring those back up once we get to Q&A.
Oh, okay. And for all of our participants, my internet is down. They are working on it in the area, so I apologize if my connection is spotty. I'm going to turn off my camera right after I reintroduce myself. But again, please accept my apologies. My name is Dana McCrary. I'm the director of the Office of Recovery Transformation in Georgia. Lindsay and our previous presenter talked a lot about, serving families that are experiencing crisis. I'm going to talk a little bit about teaming up with the parent and the youth peer specialist in our crisis response system. Next slide. So oftentimes when we are wanting to have family input in the work that we do, we start with focus groups. But, focus groups are often like a drive-by. You come in, you get input, you try to incorporate it into whatever you're building. Oftentimes that happens after you've design something, then you get family input. And so we're asking that you really partner up as you are building anything to serve parents and youth, that you incorporate their voice, that they become partners at the table and at the very beginning. To provide access to shared education and training. It's really helpful when you provide information and training to families and youth in advance, when you want them to contribute to the design of any program, any system, bringing them to the table early, providing access to training and education allows them to be fully prepared to contribute in meaningful ways. And continuous training engagement once these practitioners are employed. And then encourage and valued advocacy. Oftentimes advocacy is welcomed when you're not working for someone, but it's most important, or it's just as important when these peers begin to work for agencies. They are looking for permission to advocate, and not just advocate, but feel valued by the meaningful advocacy that they contribute. They're trying to help families and youth. They're trying to help the organization improve in ways that families and youth will benefit. Next slide. So when we think about serving families in our system and welcoming parent and youth practitioners to the table, oftentimes providers may want to just hire a youth or just a parent, but we always have to remember we're serving a family. We're serving a child that's connected to a family. And each of these practitioners has their specific role, their specific lane. Oftentimes, if you hire just one, either that parent is going to try to support both the parent and the child, or that youth certified peer is going to end up trying to support that child and that family, which can be overwhelming and exhausting. And we all have our expertise in the work that we do. That lived experience that we bring to the table is valuable, and each of the family members has the opportunity to get support, thoughtful, careful, and time to really explore what they want in their life, what goals they want to achieve, how they want to move forward. But when you just hire one, someone in the family may not get the support that they need, or as much support as they need, or inappropriate support. In Georgia, I'm not really sure about other states, but in Georgia, the parent certified peer is not trained to provide support to people's children, nor is a youth certified peer specialist trained to provide support to the parents. Next slide. Ideally, we love to see families have access to both, the parent receiving parent peer support, the youth receiving youth peer support. And the benefits, I'm going to focus a little bit about the benefits of youth peer support, is that, while both the parent and the youth cultivate connections to address isolation and loneliness, it is so important to a child. It's important to a parent not to feel alone. It's important to a child not to feel alone. But again, remembering that your child wants friends. They want to be connected to their community. The UCPS is skilled and can incorporate the child's interests in other activities. And, something as simple as anime or card games, they can use these as tools to engage, approaching the work with childlike exuberance, because they're not far from their childhood. They remember what it was like to want to live a life that was exciting, want to live a life that is full of joy. And they have that ability to relate, and providing encouragement and education. It is important for youth to take medication if they need medication, but we can't underestimate their need to know why. As a matter of fact, it should be considered, because initially this child's services are driven by the parent, but as this child is getting older, they need to be prepared to ask questions, to make decisions, to participate. And receiving youth peer support starts to prepare them for that, so that they see the benefits of medication, or they see the benefits of receiving treatment. And then having the ability to look beyond the diagnosis and see the youth. So, when peers are providing support, they remember how important it is to see the person, that mutual trust and respect. And, I can't say this enough. Respect should never have to be earned. It should be freely given. Oftentimes we may need to work for people's trust, but respect should be given from the time people walk through the door. And then that empowered preparation. Peer support, the people that we serve them for uh, expected amount of time. Then our services come to an end, and we have to ask ourselves, have we prepared this family to move forward without us? And again, they need skills that are going to help them in everyday life. They need skills that are going to help them move forward. They need a developed advocacy voice, so that they can participate in treatment and services, and identifying goals and moving toward those goals. And so there's a lot of preparation that takes place when individuals are receiving peer support. Next slide. CPSs also support that increased advocacy. I can't say that enough. Advocacy is important for the peer to have that freedom of voice when they're working within an agency. It is also important as we're serving youth and families, both for the parent and the youth, helping to improve that communication in the family. And, it's so interesting that, oftentimes what can contribute to crisis is a breakdown in the communication. And it is great when the youth communicates well with the youth peer or the parent communicates well with the parent peer, but it's more important that this family is learning how to effectively communicate with each other. And then exploring those recovery goals. Many times, if there is a frustrated parent or a frustrated youth, it may be the possibility that they're tired. If they're angry, when people are angry or if they're frustrated, it can be contributed to them being tired and us asking, are you taking care of yourself? What do you need? And helping those families learn to de-escalate potential crisis situation. While we have services in place to support youth and families who are experiencing crisis, we want to help families not live from crisis to crisis or what we call crisis-driven lives. So it's important for us not to just learn how to de-escalate crisis, but how to stop it, how to avoid it. Establishing meaningful community connections. And it's the connections that they think are important, that they think are meaningful. And we're not just talking about services, connections are what that youth are having a meaningful childhood, a meaningful life. And like I spoke about earlier, children want friends. They want to be connected to their community. And then identifying or creating skills and supports that they can use in everyday life, as I said a little bit earlier. And then that self-efficacy. Everybody wants to feel empowered enough to manage on their own. Every parent wants to be able to contribute to the success of their child. And every child, young adult, wants to feel like they are capable and able to move forward in their life. Next slide. In addition, some of the other interventions that parent and youth peer supports help with is identifying early access to messages of recovery, whether it's how you're talking about yourself, how you're talking about your future, drawing upon their own lived experience to help the family and youth find hope as a tool for progress toward recovery. Identifying the importance of self-help, self-care. This is important for the family, for the youth, and for the peer. Identifying and overcoming fears. Oftentimes, we don't want to talk about the things that we're afraid of. We don't want to talk about, our fears about the future, our fears about what could happen. But during peer support, these are some of the topic areas that are discussed. Some fears are valid, some fears not so much. And building upon this family and youth knowledge and skills so that they can move forward. This youth and this family, they have their own answers. And through thoughtful conversation and exploration, they will produce what they really want, what they think will work, and what they're willing to try. And in addition, oftentimes we don't ask families, what have you tried before, what worked and what didn't work. These are the conversations that parents and youth are having with peers and encouraging the creation of an ongoing wellness plan. Without a plan, how do we know what will work? And then revisiting to see, is that plan working or do we need to make changes? Next slide. What I love most about the work that we're doing in Georgia is that we are making sure that as peers are providing peer support, whether it is youth peers, parent peers, adult mental health, or substance use peers, that they are educating families about 988, how to use 988, when to use 988, and when it's important to dial 911 when it's appropriate. Next slide. It's not just giving somebody the 988 number, saying this is the number that you call if you're experiencing a behavioral health crisis. It's This is when you dial 988. This is how we prepare the family to dial 988 so that the outcome is successful. And this is when you might want to consider dialing 911. That language as a tool to address stigma is important. How are you making the call? How are you talking to the responders on the phone? Making sure that you're not yelling. Somebody needs to stay calm and preparing the family in advance. If possible, we shouldn't wait till there's a crisis to share this information. This information should be shared in the very beginning, teaching the whole family and natural supports about behavioral health. I know as a mother, I'm very good becoming out and able to help my child. But what was even more important, teaching my child's sibling how to respond appropriately, what to do in the event of emergency, how to be helped, and then making a call. When you make a call, provide as much information as possible. What's helpful, what's hurtful, what to deactivate. Then advocate. You can request the office, and then you can get a loved one if they are experiencing distress. Next slide. And in advance that no one has helped this family to prepare for crisis, or if they have, you want to with this family. What happened? What led up to it? What did they do? What can be done differently? We should be learning from the previous crises that happened. Otherwise, we may experience it again. We may. So the briefing is important because it gives the child the opportunity themselves, see themselves, the role they play, how they differently, how they can learn from each other. And
Hey, Dana, I think we're losing your audio. The audience is having a bit of a time hearing you. Looks like we may have just lost her. It's okay. We will move forward, and when she's able to hop back on, we will let her finish up. So before we move forward, Erica, if you want to go ahead and transition slides to the end of her presentation, then Dana can hop back on when she gets a connection. And while you guys are wrapping up, completing that, just want to, again, thank our speakers, and also thank you guys for your engagement and participation in today's webinar. Make sure that you get those Cs completed. You'll have a couple of days after the webinar for completing that. Then once you complete the evaluation, you will automatically get the certificate for that CE. Thanks again for our speakers on a great presentation. What we're going to do now after this is transition over to question and answers. As I said it before, we'll go over those questions that you guys submitted before, as well as the questions that came up in the chat. After the Q&A section, what we'll do is then transition over to office hours. During office hours, what will happen is this will be an opportunity for anyone who wants to stay on if you need any additional support or you have questions for the crisis TTAC in terms of technical assistance, which is also free of charge and available upon request. If you want to complete that afterwards, you can always utilize our website or our email to request additional technical assistance. All right, I will pass things over to Cindy as we transition over to office hours. Anyone who wants to stay, please do so. Before we do that, I want to give you guys a reminder of an upcoming event that we have. So we have a webinar that we will also be hosting from the SAMHSA Crisis TTAC. It's called Mindset and Philosophy, which is focusing on the stepping stones to integrated implementation across the crisis continuum. That is going to be on July 10th. I am also sharing in the chat the link to our website as well. So if you have any questions or if there's any additional needs that you have, you can also reach us utilizing the contact information on this slide. And I've also shared that link for you guys in the chat.